Good morning, everybody. My name is Dr. Lin. I'm a consultant from Department of Surgery, Changi General Hospital. Thank you for taking time off to join us in this public forum to discuss a very important health topic that we face in the modern times, uh, not only in Singapore but certainly worldwide as well. The topic of my talk today is obesity and how to maintain a healthy weight. This is the scope of the talk today. Right? So what is obesity? How do we define it? Obesity is a buildup of excess fat in our body that leads to health problems and a significantly lowered life expectancy based on a paper published recently. It can be as much as 5 to 7 years compared to people with healthy weight. We use a metric called BMI that I'm sure everybody is very familiar with, that allows us to not only classify the patients in terms of their body weight, but it also gives us a correlation in terms of the health risk. The higher the BMI and the higher the health risk that we have. So what is the scope of this problem in Singapore? Well, we know that more than 1 in 10 Singaporeans, adult Singaporeans, have a BMI more than 30 and are considered obese. This is a significant number. It's not as high as numbers in the Western countries like the United States or Western Europe, but nonetheless, it's a significant problem. Right. Based on statistics that MOH collected in 2017, we can also see that a worrying trend developing. The children nowadays are also increasingly overweight, and we know that this state of obesity in children correlates strongly with the state of obesity when they become adults. Certainly, this is a big drain on our healthcare resources. We can see that up to about $2 billion. This is costing us in terms of healthcare spending as well as lost productivity in work. More importantly, if nothing is done by the year 2024, this number is expected to reach about 15%. Why is it relevant to our talk today? We can see that based on data from the National Health Survey, in ethnic groups with a higher incidence of obesity, women are also more affected in terms of than men. And we know certainly that the health impact and the psychological impact of obesity is higher in women than in men as well. So why is obesity a problem? From this diagram here, you can see that obesity is associated with a long list of conditions that affects all the major systems in our body, all the way from the brains down to the joints. And these are only the physical problems that we are talking about. We are also concerned about the impact on the psychological and mental health of our population as well. There's certainly a very long list of conditions, and we're not going to go through every one of them, but I would like to focus on two that are very common and very important in Singapore. The first is cancer. You can see on this diagram on the right. This is statistics from the UK, and you can see that the larger the circle indicates that the cancer are more strongly linked with patients being obese. Now, we don't have similar data in Singapore, so we can only extrapolate this. But as you can see, based on the Singapore Cancer Society data, the three cancers that are most strongly related with obesity, being breast, bowel, or the colon, and the womb, the uterus, right? These are certainly the 3 of the top 5 cancers in Singapore that affect women in the recent years. So you can say that by reducing the incidence of obesity, we can certainly try to reduce the incidence of cancer in Singapore. Right? So the next problem that I want to talk about is diabetes. I think some of you might remember this newspaper article in the National Day rally a few years ago. Our PM as well as the Health Minister declared Singapore's war on obesity. Singapore's war on diabetes. Obesity, we know, is a major risk factor for diabetes. Okay, why is that? We know that patients who are obese have a higher risk to develop diabetes and certainly at a younger age, and this is due to the concept of increased body fat causing insulin resistance. We also know that patients who are obese require more medication and earlier use of insulin to keep their diabetes under control. And all in all, these all contributes to the patients having a higher risk to develop complications from diabetes. Now we know that diabetes is usually a silent disease. It doesn't cause you to have any symptoms of pain or discomfort. And usually when they come, it's already a sign of a complication or organ damage. And these are as varied as obesity as well. It can affect all the major organs and systems of our health, of our body, as shown in this diagram here. So other than the impact on physical health, we also know that obesity has a significant impact on mental health and well-being. And often there is a vicious cycle that results between obesity and mental health issues. A lot of people use eating as a mechanism of coping with stress. That will definitely contribute to obesity. And once patients are obese or overweight, and that it affects their self-confidence, their mental self-image, their work-life balance, opportunities, and that those can lead to mental health issues like depression or adjustment disorder as well. So what causes obesity? So we now have to try to understand this a little bit better so that we can try to maintain a healthy weight and try to reduce the incidence of obesity. This is the traditional concept of what we think causes obesity. Right? It's a balance between the energy that we take in and also our energy expenditure. Right? So what happens is with more caloric intake and less energy expenditure, this leads to an imbalance, and eventually this leads to putting on weight and obesity. But we now know that this is an oversimplistic way of looking at obesity and weight gain. And one of the most important misconception that we have is actually the concept of energy expenditure. Right? What constitutes energy expenditure? We used to think that it's just physical activity and exercise, but now we know that that is actually a very minor contributor to our energy expenditure. Most of our energy expansion actually comes from our basal or resting metabolic rate. This refers to the energy that we are burning when we are actually not actively performing physical activity. Okay. So what are the factors that contribute to obesity? And if you look at this very complex diagram here, you can see that there are so many factors that we now know contributes to weight gain and obesity. Some of these factors are very intuitive and very well known, from things like easy availability of high caloric junk food to increasing sedentary lifestyle. But some of the things are pretty new and actually rather surprising. So one of the very interesting new research finding is that our gut microbiome actually contributes to obesity and weight gain. What that means is that the good bacteria that lives and colonizes our intestine actually have a very big effect on our energy balance and potentially can contribute to obesity. The other thing that is also not traditionally discussed when we talk about weight gain or obesity is actually sleep. We now know that having good quality sleep with sufficient timing is actually very important to maintaining a healthy weight. So as you can see, many factors contribute to obesity and make it a very complex and multifaceted condition to treat as well. So in terms of women's health, these are some of the milestones in life where possible weight gain can occur. We can broadly classify this into two groups, right? The first group is of course intrinsic hormonal changes. See puberty, like pregnancy and menopause, and the other group is probably what we call extrinsic environmental factors, and these that leads to a severe change in our lifestyle, and those are from things that starting work, getting married, and entering motherhood. So we can't go through this talk without talking a little bit about COVID. Right? And so this, I think, illustrates perfectly our increasingly obesogenic environment. Right? When we in the past, when we wanted to have a plate of chicken rice or have a burger, we'll have to go down to the coffee shop or the restaurant to eat it or to take it away. But nowadays, we don't even have to do that. We just take our phone, punch in a few numbers, and it gets delivered straight to our doorstep. So this leads to, of course, decreased energy expenditure and easier access to a wide range of relatively unhealthy food as well. All right, but as we can see later in the next section, all right, how we look at environmental factors it is heavily dependent on our mindset, and I think this is again a very good example to illustrate this. So as you know now, working from home is becoming the norm. So some people may say that they actually have a decreased energy expenditure and exercise because they are now no longer commuting to work and they are at home all the time, and that has increased to weight gain. Whereas if you flip the coin around, you can say that since you have more free time from not having to commute, then it gives people more free time to exercise. So as we will now take a look at some tips that we can use to achieve and maintain a healthy weight. The concept is similar again. All right. We try to decrease our calorie intake, increase our energy expenditure, and hopefully that will allow us to maintain a healthy weight. So these are some of the stages in behavioral change, from the trigger, which is the contemplation, to thinking about the problem, getting prepared, and then of course taking action. But what we think is the most important and is the hardest to do is actually what we call maintenance. How to build these changes into your life so that you can and keep persist doing it for as long as you can, and to prevent a relapse in the problem. So let's talk about diet. You might have heard of so many diets out there that people are advocating, um, and the fact that there are so many of them, it just means that there is no one that is perfect, and very increasingly we realize that different diets may work for people with different body composition or body types. So our advice is choose the diet that works for you. If you have two kinds of diets that work for you, one gives you better weight loss result, but um, it's very difficult for you to practice, then the other one where you have a slightly worse outcome, but allow you to persist in doing it, is actually probably the one that's going to be more effective. Right, so the ability to persist and stick to the dietary plan is more important than the kind of the diet itself. So these are some of the, the tips to achieving and maintaining a healthy diet. So eating fresh, to avoid processed food as much as possible. Prepare your own food so that you can control the things that go into your food. Eat a mainly plant-based diet. Eat a small amount of a large variety of food so that you can minimize whatever detrimental effect of the food that you're eating. Develop a habit of checking the labels. Choose things that are lower in calorie, lower in sugar. I think our health promotion board has done a good job in using the healthier food choice label to help us make these decisions. We know that it's not only the kind of food that we eat that matters, but also the way we eat. It's important to stop eating when you are no longer hungry, and eating just the right amounts. And how do we go about doing it is actually eating slowly, uh, enjoying your food, savoring it, and basically just focusing on the food itself. This is a concept of what we call mindful eating, and it allows us to be more in tune with the sensation of satiety or fullness that we feel, so that we can actually stop eating when we are full. Um, Moving on to exercise, again, the ability to persist with exercising is more important than the type of exercise itself. So we will try to make it social. All right, having somebody to exercise with you definitely allow us to persist with exercising, making it fun, doing a variety of exercises rather than doing the same thing all the time. And of course, putting in measures to prevent injury, because that will definitely hamper our our effort at persistence. I'm sorry. Right? Why is this important in terms of exercise? Right? Remember this diagram just now when we talk about the basal metabolic rate. We now know that um, the true value of exercise and physical activity is in changing or altering our basal metabolic rate. As we build more muscles, as our body fat drops, our body is able to use energy more efficiently, and that's why we can increase our basal metabolic rate by frequent exercising. So if you have somebody who exercise only when they take a large meal or high caloric food, then it's not going to be as efficient as somebody who exercise more regularly in terms of maintaining a healthy weight. Right, so how much is enough? Usually we talk about the duration and the intensity. For duration, we ask our patients to try to hit a total of about 150 minutes a week, so about 3 to 5 times a week, and 30 to 60 minutes each time. The intensity of the workout should be high enough as well. If you have a heart rate monitor, then try to aim for a heart rate of more than 100 minutes, 100 per minute during the workout. At the end of the workout, you should feel slightly breathless and unable to speak in full sentences. Should be sweating throughout the workout, and the intensity of the workout should increase with the fitness and conditioning. Uh, Again, I think our ministry has done a good job in trying to encourage this. As here, these are some of the initiatives that we are all familiar with: the Health 365 National STEP challenges. And if you're not aware by now, ActiveSG, that is an app that actually aims to help us in the persistence of exercise by bringing variety and also building a social aspect to exercising. Right, so once again, we go back to this diagram, and we really want to stress and focus on the fact that the maintenance and ability to persist is much more important than the measures that are being undertaken as well. So we now know that also beyond a certain BMI, which is about 35, the effects of lifestyle measures like dietary modification and exercise have limited efficacy and durability for a patient to regain a healthy weight. And these are actually patients that we will need to see to help them formulate a plan for them to regain their health. We have multiple modalities that we can use, and oftentimes all these modalities are used together to treat a patient. They range from lifestyle therapy and changes, including exercise therapy and psychological therapy, nutritional therapy, where we have professional nutritionists and doctors prescribing diets, and even a concept of meal replacement, right, for a period of time to bring the weight down. There are certain medications we can use to suppress appetite and to alter the basal metabolism. And of course, the last being weight loss surgery. It is probably the most effective and durable measures that we have for weight loss, but it also has some risks involved in it. So who are the patients that qualify for surgery? We typically say that based on our ministry guidelines, patients with BMI more than 37.5 or BMI more than 32.5 for patients with obesity-related conditions like diabetes and sleep apnea should be counseled for surgery. In Changi, this is the overview of the journey that the patient takes when they decide to go for surgery. And you can see that it's a very comprehensive program. It starts all the way from the first clinic visit. We counsel and assess the patient, to pre-op assessment and workup, to the surgery itself, and then of course to the post-operative follow-up. We usually use a multidisciplinary team approach, right? Because we know that surgery is not a magic bullet, magic solution, and without the resulting dietary, lifestyle, and physical activity, behavioral modification, there is a significant chance of weight regain. Right. So in summary, we know that obesity is a serious health problem with pretty serious consequences. And the detrimental effect of obesity goes beyond physical health, with severe effects on mental health and well-being as well. Women are more likely to suffer from obesity, and when they have obesity, the impact on their physical and mental well-being are more severe. In order to maintain a healthy weight, sustained dietary and lifestyle changes are key. And of course, in patients who are morbidly obese, then a multidisciplinary team approach under an experienced team will lead to better long-term weight loss outcomes. Right, so this is the end of my talk. Thank you for your kind attention. I'm happy